nurse. I'm going to be doing a thorax and lung assessment on you.
Okay.
Is that okay?
Yes.
All right. So can you please tell me your name and your date of birth?
My name is Stephanie Thomas, and I was born yesterday.
Yesterday. Excellent.
I'm okay.
Do you have any allergies?
No, not allergies.
Okay. Do you have any, do you smoke?
No smoking.
Okay, have you ever smoked?
No.
Okay. Any difficulty breathing, any shortness of breath that I need to be aware of, any respiratory illnesses? Okay. Okay, so first I'm going to go ahead and inspect. I'm going to inspect the posterior thorax first, and then I'll do the anterior. So I'm going to ask you, thank you, very cooperative patient. I'm going to raise your head of your bed up a little so that it doesn't break my back, okay? You're comfortable like that? Many patients will not be able to do what she just did. So you can assess them kind of from the side, but this just makes it easy. Are you okay if I untie your gown?
Mm-hmm.
No, I think you're okay. I'm just going to keep it like that. Okay, so as I came in and was looking at her from the anterior aspect, I was taking note that there was no work of breathing. I didn't see any nasal flaring. She wasn't using any pursed lip to breathe or any of her accessory muscles, and her skin color was very appropriate to her ethnicity. There was no paleness or cyanosis that would indicate she was having a hard time oxygenating. So that was just first as I came in. Now I'm going to assess the posterior thorax, and I note that you are sitting with your arms to the side, kind of in your lap. Your scapula are symmetrical. I don't see any protrusions. It looks like your shoulders and scapula are equal in that horizontal position. I'm going to go ahead and touch your spinous process. That appears straight as we're sitting here, and looks like your ribs are sloping down about a 45-degree angle in relation to your spine, which is all great. From the posterior view, I'm also looking to see if she's using any accessory muscles, see if she's having any work of breathing, and I do not note any of that. Her posture and positioning is upright and relaxed, and she's breathing easily with her arms in her lap. At this point, I'm going to look at her AP diameter. So anterior, posterior diameter, as opposed to her transverse diameter. And it looks to me to be AP 1 to transverse 2, which is a normal finding, an expected finding for her. I'm going to go ahead. Are you okay if I touch your back? I want to do a little palpation and percussion. Do what we call palpation, and I'm just basically feeling the skin and feeling for it. When I touch your back, can you please tell me if there's any soreness?
Mm-hmm. No soreness.
Any abnormal sensations?
No.
Okay. And so I'm also going to test for what we call crepitus, which is a crackling under the skin. And I don't feel any of that. Okay. There's something that's called fremitus, and when I place my hands on your back, I'm going to ask you to say 99. So every time I move my hands, say 99 for me, okay?
99, 99, 99, 99.
Okay, thank you. And I'm going to assess for your chest expansion. So I'm going to place my thumbs on the posterior side of your chest, kind of at T9, T10, and I'm going to ask you to take a deep breath. If you don't mind, I'm going to raise the bed a little bit higher. Okay? Okay. So I'm going to put, can you see me? Can you turn a little bit, like angling that way? So yeah, perfect. Okay, so I'm going to find T9, T10. I'm going to put my thumbs together, and then I'd like you to take a deep breath in and back out. One more time. Okay. So I'm noting that your chest expansion is bilateral and moves about 5 centimeters apart. And you said there was no sensation or tenderness at any of the areas I palpated.
No.
Okay, so now I'm going to do what's what's called percussion. I'm going to percuss this back part of your, the posterior view of your thorax, and I'm going to hold my finger here, and I'm listening for what we call resonance. So this is the apices of your lungs, and now I'm going down. And it sounds, I heard resonance. I don't think that there's any cause for concern or any abnormalities we need to deal with on that. And then lastly, I'd like to auscultate your lungs, which means I'm going to place a stethoscope on your back. I'm going to warm it up for you a little bit. And when I place the stethoscope on your back, if you could take slow, deep breaths each time I move the stethoscope, but please tell me if you're getting short of breath when I do that. I'll try to take some breaks. I'm going to use this zigzag pattern. Take a deep breath. Thank you. You did a really good job. I didn't give you any break on that. So your lungs are clear bilaterally from the posterior thorax in all fields. I'm going to go ahead and do the anterior side. Again, I'm looking at her chest wall. I'm looking at the shape and configuration. That AP diameter is the 1 to 2. So that does not indicate any barrel shape configuration. Looking at her sternum, and it looks to me to be midline and straight. She has no retractions, no use of her intercostal muscles. I'm looking at her breathing pattern and effort. It seems very even, effortless, quiet, and again, the ribs are pointed downward, and her intercostal spaces look very symmetrical. So that's my inspection of the anterior chest. Now to palpate the anterior chest, all I'm going to do is I'm going to place my hands like right below your clavicle area, and I want you to tell me if you have any tenderness or sensation. I'm feeling for any lesions or any abnormalities, and I'm also masses, and also feeling for that crepitus we talked about. Okay, so you don't have any tenderness? Okay, all right. Now I'm going to go ahead and auscultate your lungs. Again, like we did in the posterior, I want you to take a deep breath and let it out when I put my stethoscope on your chest. Hold that up for me while I listen underneath your shirt. Okay. 2 more spots. 1 more. And 1 more. Excellent. Good job. Oh, come around to this side to assess that right middle lobe. I'm going to do it on the lateral aspect. Again, on your skin. Oh, you're fine. You can just go straight. Okay, take a deep breath and let it out. Okay, thank you. Go ahead and put that back on for me. Your lung sounds were clear bilaterally in all of the lung fields. This concludes the thorax and lung assessment. Thank you, Ms. Thomas, for being such a great patient. Are there any questions that you have for me? Okay, are you so comfortable? You okay?